and 18 clinics. So our topic for discussion today is preventing and managing high cholesterol. So we'll get started. Again, welcome. This is being sponsored by our Quality Partners in Care with Health Texas, and the discussion is prevent and manage high cholesterol. So the topic that we're going to discuss, I always kind of like to give you an overview of what we're going to be talking about. So the first thing we're going to do is talk about what is hyperlipidemia or high cholesterol. We're going to talk about what is cholesterol. We'll have a discussion, a quick discussion, but on the LDL, which we call the lousy cholesterol, and the HDL, which we call the happy cholesterol. That's how people help remember which is which. How it's diagnosed, the appropriate ranges for cholesterol level, what causes hyperlipidemia or high cholesterol. We'll talk about how to prevent and to control high cholesterol. And then we'll talk about some things that help us to manage our cholesterol, to include healthy eating habits, lifestyle changes, increased physical exercise and activity. We'll talk about medications, and then when and how we should be following up to manage our cholesterol level. So the first thing we want to know is, what is high cholesterol, or what is hyperlipidemia? So hyperlipidemia, better known as high cholesterol, means there's too much bad cholesterol or LDL cholesterol in the bloodstream. This causes an increase in fatty deposits in the bloodstream. So if you can imagine for just a moment, if you were to fry bacon, and you know the residue from the bacon, when it's warm, it's clear. You leave that skillet sitting on the stove for about 5 minutes and it goes to room temperature, then all of a sudden it's no longer clear. It's solid. And I always try to remind our patients, if that fat is solid in a room temperature skillet, what is it doing in our body? So if you can, for just imagine a moment, imagine that, and I don't hope not to gross anybody out, but basically it's doing the same thing. These are fat deposits that are remaining in our bloodstream, and they clog our arteries and our vessels, and it causes an increase in the risk of blockage. So it's very important that we're managing our cholesterol levels to prevent cardiovascular events. So cholesterol is a form of fat that the body naturally produces. It helps us to prevent certain illnesses. It helps with certain functions in the body. So a small amount of fat is good. The problem is it travels through our bloodstream, and if there's more than what we need, then we don't properly transport vitamins, our minerals that we need, and it even helps with our digestive system. Too much fat causes delays in our digestion. It takes us a little bit longer to process fat than it does any of the other nutrients that we consume, to include our carbohydrates and our protein. So there's two different forms of cholesterol. Our LDL, which is our low density lipoprotein, which is our bad cholesterol or our lousy cholesterol. And then this form of cholesterol is what builds up in the arteries, builds up in the bloodstream, causes all sorts of complications for us. And then you have the HDL, which is the high density lipoprotein. That's our good or our happy cholesterol. And this cholesterol is what transports that cholesterol from the bloodstream to different parts of the body and is utilized in the metabolism of our food, the secretion of hormones, the movement of certain nutrients in the body. So hyperlipidemia or high cholesterol, basically they call a silent killer. And the reason it's a silent killer is there's really no symptoms for having high cholesterol. The way that you know that you've got high cholesterol is through a blood test. And that blood test is called a lipid panel or a lipid profile. And when we do a lipid panel or lipid profile, they're looking at your HDL level, your LDL level, and your cholesterol level. And the way that that works is in the body, the lipoproteins work like a seesaw. The higher the bad cholesterol, the LDL, the lower the good cholesterol, HDL. So as we make changes in our lifestyle and we improve our HDL, we also lower our LDL. So it's a balancing act. So that's important for you guys to remember, the seesaw effect with our cholesterol. It's important that you know the range of cholesterol. One of the things that we talk about when we're meeting with patients is getting your cholesterol at normal range. And if you're not aware what those numbers are, you have no idea what they're talking about. And like I said, because it's a silent killer, unless you've had a lab test, you have no idea where you are on those ranges. So for the values, a LDL or a total cholesterol is desired to be less than 200 milligrams per deciliter. The LDL, we'd like to try to keep between 70 and 100. Usually patients are told under 100 for your LDL is good. For your HDL, we want it higher than 40. Now, I know that sounds like that's an imbalance. You've got an LDL at 100, but you've only got an HDL at 40. The high-density lipoproteins are best served between about 40 to 50%. So the other thing we're looking at is the triglycerides. We want to keep our triglycerides under 150. The triglycerides are a component of the total cholesterol. So the three components we're looking at are your HDL, your LDL, and your triglycerides. And as the LDL rises, so does the triglycerides. Go back. Now we talk about the ranges we want to keep them in. And individuals are categorized based on having a desirable cholesterol level, a borderline cholesterol level, and a high cholesterol level. And as you can see on the two of these slides, the parameters are the same. But we just talked about the desirable levels for LDL, HDL, and total cholesterol. Borderline is if your total cholesterol is between 200 and 239. High risk, you have a total cholesterol level of greater than 240. You are at the highest risk for cardiovascular events, heart attacks, and strokes when your total cholesterol is at 240 or higher than 240. Borderline for your LDL is 130 to 159. High risk is greater than 160. And then the HDL, there's really no parameters for borderline, but there are parameters that say when your HDL drops below that 40 level, you're at high risk for, again, cardiovascular events. And that's again for males. Females, it's below 50. And then anyone that has triglycerides greater than 200, again, you are at the highest risk for cardiovascular events. The American Heart Association has published these as the parameters for maintaining healthy cholesterol levels in the hopes that we can reduce and prevent cardiovascular events. So what causes high cholesterol? Anybody got any ideas? If I could have shown a picture of McDonald's and a large basket of fries, that's been it. But so I don't get sued, I didn't do that, okay? So There's a lot of different things that can cause, you to have high blood cholesterol. Family history. If there are other people in your family with high cholesterol, that puts you at risk for having high cholesterol. Yes, it is genetically passed down. And if your lifestyle is such that you lead a sedentary lifestyle, and what I mean by sedentary is the only exercise you're getting is lifting your fork from your plate to your mouth and back, or you've got athlete thumb from sitting in your recliner and changing the remote on the TV, that puts you at risk for having high cholesterol. You're not getting enough movement, enough activity, because we burn some of that fat along with the carbs, which turn into sugar, when we exercise, and those are burned in the muscle tissue. Not only does our lifestyle and our physical activity affect our cholesterol levels, so does obesity, alcohol consumption, smoking. All of those play a role in whether or not we have high cholesterol. And as you may know, as we get older, our metabolism changes. So things start to slow down. And so we're not metabolizing this fat as well as we did when we were 19 or 20. And I know you guys remember when you were 20 years old, you ate a whole pizza and it was good. Now you ate 3 slices and you might as well have rubbed it on your rear end somewhere because you end up with these fat deposits. So as we grow older, our metabolism changes. We're not able to eat as much. We don't burn as much fat or carbs for energy. And our lifestyles, for most people, change. We're slowing down, which then again allows us to store more fat. So not only do our age, our weight play a role, your ethnicity, your family's origin, where you came from, also play a role in whether or not the gene for high cholesterol is passed on. A great deal of the ethnic population that have high cholesterol are African Americans, Hispanics, Native Americans, and Asians. Most people of color. So, causes of high cholesterol. Okay, disclaimer right now, that is not McDonald's. But again, our diet, having unhealthy meals can have a big impact on our cholesterol. What we don't necessarily understand is in our society today, the average middle school child, not even counting the adults, but the average middle school child consumes 80% of their diet from either fast foods, processed foods, or vending machine foods. And as a society, people don't understand that processed foods are designed to increase shelf life. The longer something can sit on a shelf in a grocery store, the more likely it is that that food item will be purchased rather than discarded as waste. So the longer we can keep something at its current state, the more profitable it becomes to the manufacturer. The problem with that is processed foods are processed to extend shelf life with one of or a combination of 3 things: fat, salt, or sugars. The sugars that we don't burn and store, we store as fat. We can develop conditions like fatty liver. And of course, salt causes us to retain fluids, which causes additional stress on the heart. And so processed foods all around are not our best friends when it comes to living a healthy lifestyle. The lack of physical activity or exercise causes an increase. Again, like I said, we're not burning that fat. We're not burning that sugar. And so what remains in the body, we store as fat. And that fat, again, in our arteries and in our bloodstream causes that buildup of plaque, which we know is the high cholesterol, that high fat in the bloodstream. Obesity. Obesity in itself can be a #1 factor for a number of chronic diseases, to include hyperlipidemia or high cholesterol, diabetes, cardiovascular disease, fatty liver, non-alcoholic cirrhosis, and a number of other medical conditions. So being active and being able to burn some of that fat is conducive to a healthier lifestyle. And what other people don't understand is alcohol consumption can also affect our cholesterol. The consumption of alcohol beverages can increase your cholesterol level. First of all, if you think about it, most alcoholic beverages turn into sugar. And again, we're storing that sugar as fat. So we need to limit or alleviate our alcohol consumption. Some other causes: smoking. I never say this word right, but it's acrolein. It's a chemical that's found in tobacco, and I love the way that it's described. Acrolein stores dense hypolipoprotein, and it's a yellow, foul-smelling agent. And just think, we're inhaling that into our lungs and into our digestive system and into our bloodstream. Not good. We already talked about the fact that our age causes us to be at risk. As we get older, not only are we having less activity, changes in our metabolism, we actually have a natural narrowing of our blood vessels. And so if we have a narrowing and then you've got these blockages, you're walking around with a neon sign on your head that says, I have high cholesterol. The ethnic groups: people from India, Pakistan, Sri Lanka, I can't talk today, and Bangladesh have increased risk. They are the highest population for high cholesterol in the world. And other causes of high cholesterol can be some underlying health conditions. They can affect your ability to burn some of that cholesterol, burn some of that fat. Again, we talked about diabetes, liver disease, kidney disease. Those are some of the chronic illnesses that impact your cholesterol level and your ability to metabolize some of that fat. So, the importance of cholesterol management. How do we manage it? High cholesterol can be lowered or reduce the risk of heart disease and stroke. If we can get our cholesterol down, each time we can bring our cholesterol down to normal level, we reduce our risk for those cardiovascular events that we talked about. Changing behaviors can go a long way in regards to managing your cholesterol. And knowing those numbers can help you to gauge where you are in managing your cholesterol. And then again, the third step in managing is medications. For a number of people, they are put on medications to help to manage their cholesterol. And one of the things that we talk about when we're dealing with people with diabetes, the deadliest combination for cardiovascular events is high blood sugar, high blood pressure, and high blood cholesterol. So if you can impact your lifestyle by making changes, one, you can reduce your risk for all three of those things, which again reduces your risk for cardiovascular events, the heart attacks and strokes. So if you're diagnosed with high cholesterol, what do you need to do? One of the first things you need to do is, if you are a smoker, stop smoking. Because cigarette smoke has a variety of issues that impact your cholesterol, your blood sugars, your lung and heart function. So we tell our patients, first thing right off the bat, if you're smoking, we got to help you to get you to smoking cessation, because we got to stop the cigarettes. Losing weight can also improve your cholesterol levels. A weight loss of less than 10% can help to improve your high cholesterol number. So if you're at 200 pounds and you can lose 20 pounds, that helps to reduce your risk factors. And the American Heart Association also provides additional information on steps to lowering your cholesterol. And this is the website for you. It's actually a YouTube video that you can log into, and it shows you like a webinar, very similar to what we're doing, on steps that you can take in lowering the cholesterol levels. We lose you? Can you cut and paste it? Hold on one moment, guys. We're going to try and see if we can get that. If we can't, won't let you copy it. Okay.
I'll send it out to everybody that pre-registered. So you, when I send the recording, I'll send that link out to everybody. It's not allowing me to, since I'm in the presentation mode, it's not allowing me to screenshot it and put it into the chat.
But we definitely will get that to you. Is there another question? Okay, so there's a correlation between high cholesterol and high blood pressure. I just told you between the high blood sugars, high blood pressure, and high cholesterol. Those three are the deadly combination for heart attacks and strokes. It's funny, in my clinical practice in the past, we called that the Bermuda Triangle. Okay, so is there a direct correlation between high cholesterol and high blood pressure? I just gave you the answer to that. Yes, there is. Absolutely. Okay, as the cholesterol builds up, it causes a narrowing of the artery. That narrowing of the artery is then making it harder for the heart to pump this fatty blood, if you will, through the arteries and veins, making the workload of the heart increase. And as we increase our workload, our cardiac workload, we put stress on the heart. And this increased workload leads to heart attacks and strokes. So to answer that question, is there a direct correlation? Yes, there is. Because high cholesterol leads to having high blood pressure. That additional pressure on the heart increases the workload. Increased workload can lead to heart attacks and strokes. So one of the things I wanted to bring to your attention, which was very interesting, is when you look at the American Heart Association's risk factors for heart attacks, it lists high cholesterol as one of the risk factors. And if you notice, it's at the top of the list, along with other things like metabolic syndrome, kidney disease, inflammatory conditions, and high risk ethnicity. But when you go to the next one, when you look at the risk factors for high blood pressure, what else does it list? It lists high cholesterol. So there's a direct correlation between the two of these and the effects on our cardiac system, which again can lead to heart attacks and strokes. Now, there are two different kinds of risk factors for having high blood pressure. The risk factors that we are able to control, which are our modifiable risk factors, and then the risk factors that we have no control over whatsoever. The things that we can do to change high blood pressure are, one, increasing our physical activity. If you have low physical activity, like I said, all you've got is fork-to-mouth syndrome, that puts you at a higher level of risk for having high blood pressure. If you have an unhealthy diet, if McDonald's is the first thing your kids learn to say, that leads you to understand that maybe your diet is not very healthy. And the reason I bring that up is when my daughter was 18 months of age, she couldn't read, but we passed an 18-wheeler one day, and she goes, McDonald's, Pizza Hut, Taco Bell. And I thought to myself, we need to make some lifestyle changes here. Yeah. So being overweight can cause, again, do these sound familiar? The same risk factors you have for having high cholesterol, you have for having high blood pressure, diabetes, smoking, and the use of tobacco. And believe it or not, your stress levels can affect your blood pressure levels. Your blood pressure levels can affect your cholesterol levels. So there's, again, another direct correlation. Things that put you at risk for having high blood pressure that you have no control over, your family history. If there's someone else in the family, especially the immediate family, mother, father, sister, brother, first cousin, if there's a family history of high blood pressure, the risks are higher for you that you will have high blood pressure, along with these risk factors that you can change. Your age, again, as we get older, we are at higher risk. We seem to start to detect high blood pressure in adults between the ages of about 35 to about 55. For most people, that's when we start going through hormonal changes as well. Your gender. It used to be that the male gender had a higher risk and a higher level of heart attacks and strokes. But in about 20 to 30 years ago, as women begin to take into and take over the workforce, we are now seeing more women with heart attacks and strokes than we do men, which is very scary. And your ethnicity or your race, your family's origin, your culture play a role in whether or not you are at risk for having high blood pressure. And then if you have high blood pressure, that can affect your kidney filtration, which can lead to kidney disease, and kidney disease in turn can lead to high blood pressure. So it becomes a catch-22 in regards to modifiable and non-modifiable risks. So what causes the damage that's related to high blood pressure? Well, it's that buildup of plaque in the arteries and the inability of the body to be able to appropriately move blood through. It's kind of like if you were to take a piece of PVC pipe, and then that PVC pipe on its own allows water to flow through. If you take and maybe add some wheat paste, the inside of that PVC piping, it creates a crust, if you will, which causes a narrowing, which means blood flowing through, you're not getting as much volume, and you're getting more friction. It's harder for it to move through. And as we add more to the interior of that blood vessel or that PVC pipe, the friction becomes higher, or the pressure, and the ability to move fluid through becomes harder. And that's what happens in the human body. As we build plaque in our blood vessels, the viscosity or the thickness of the blood increases. It increases the work of the heart to push fluid through blood. And then that friction causes increases in our blood pressure. We brought this slide up not because it has a direct correlation with what you see, but because the incidence of heart attack and strokes are so high. I felt it was important that you had just a baseline knowledge of what to do if someone is experiencing stroke symptoms. because high blood pressure, the number one condition that occurs with high blood pressure, stroke and heart attacks. So when we are looking to determine if a person has symptoms of a stroke, we use the acronym FAST. Face. We're looking at the face to see, is there asymmetry? Is there a drooping arm? Is there one-sided weakness? Is the individual able to raise their arm equally on both sides? Speech. Listen for slurred speech or aphasia, an inability to be able to express what they're talking about. And T is for time. Call 911 immediately. Time is of the essence. For a lot of individuals and a lot of stroke symptoms, the sooner the person can receive medical care, the less detrimental the stroke may be. Okay, so we just kind of wanted to bring an awareness of what the symptoms look like and what to do. So, treatment for reducing our cholesterol. Number one is a healthy diet. Our diet should consist, for most people, of a plan that is 1/2 of your plate to be healthy fruits and vegetables, 1/4 of your plate to be your carbohydrates, and 1/4 of your plate to be your protein sources. The thing that is important for you to understand when we start talking about 1/2 of your plate being fresh fruits and vegetables have carbs too. And so when you're looking at a healthy plate and 1/2 your plate's fruits and vegetables, 1/4 of your plate is protein, and 1/4 of what you're consuming is carbs, you got to look at your carbs in your fruits and vegetables as well. But generally speaking, most carbohydrates that you find in your fruits and vegetables are going to be complex if they're fresh fruits and vegetables. So we want to try and consume as many fresh fruits and vegetables as we can and stay away from processed foods. Okay? So step one is a healthy diet. Step two, exercise. Step three, lose weight. A healthy weight puts you at less risk for having the complications of high cholesterol and high blood pressure. And again, smoking cessation. Those are the golden rules for reducing your blood pressure and reducing your cholesterol. So, what food should I eat and what food should I avoid if I have high cholesterol? Well, the foods that you should eat are going to be your omega-3 and omega-6 fats. Everybody goes, I know. Salmon. Yes, salmon, sardines, tuna. Those all have healthy fats. We want to avoid hydrogenated or polysaturated fats. Our saturated fats generally come from animal fats. And hydrogenated fats are those that are solid at room temperature and liquid when heated, but return to a solid state back at room temperature. What that means is the fats that we want to avoid are things like pure butter, thick margarine, Crisco, lard, animal fats such as bacon grease. Those, as I stated earlier, if they're solid at room temperature, what are they doing in our arteries? So the foods that we want to eat, again, are going to be the healthy fats, things like avocado, nuts, fish. I always tell my patients, too, when it comes to deciding what's a healthy source of protein, the less the feet, the better the meat. And some of you guys have this look on your face like, what are you talking about? Let me give you a prime example. How many feet does a pig or a cow have? 4, right? How many feet does a turkey or a chicken have? 2. How many feet does an egg have? How about a fish? How about mushrooms, edamame, or tofu? The less the feet, the better the meat. So, common fats. I think we just kind of talked a little bit about that. I got a little ahead of myself. But what you want is you want to have your polyunsaturated fats or monounsaturated fats. You want to make sure that you're getting your fatty acids. And this slide provides you information on the food sources, the effects of the foods, and I can't go into a whole lot of detail with that, but just in summarizing the type of fat that's best suited for individuals with high cholesterol are things that are polyunsaturated, such as our omega-6 and our omega-3 oils, and monounsaturated fats like olive oil, olives, avocados, canola oil. I brought avocados up the list because that's my favorite. But and some seafood. Now, sometimes seafood gets a bad rap, but most of the cholesterol in seafood we don't digest. But we need to limit our seafood consumption to no more than once a week, preferably no more than once every 2 weeks. And when I'm talking about seafood, we're talking about the crustaceans. We're talking about crab, shrimp, lobster, mussel, clam. Those are generally higher in cholesterol than your other lean meats and fishes. So, exercise. We've already talked about the need for exercise in lowering our cholesterol and in lowering our blood pressure. 30 minutes of exercise, bringing the heart rate up to about 150, helps to maintain where you're at. If you're trying to reduce your cholesterol, lose weight, lower your blood sugars, 60 minutes of activity with the heart rate above 150 burns calories, burns fat, and burns sugar. So the recommendations are, if you want to lower your cholesterol, lower your blood pressure, and lower your blood sugars, you want an hours of exercise, hours of activity, about 3 to 5 days a week. That doesn't necessarily mean running a marathon. You can do passive exercises from a chair, alternating upper body movement and lower body movement, but it needs to be consistent enough to get the heart rate up. So it really doesn't matter what you move as long as you move. Smoking. I know we sound like we're beating a dead horse, but smoking can cause so many problems. Cigarette smoke, it's harmful, and it destroys just about every organ in the body, and it causes disease, and it reduces the health of the smoker in general. It's estimated that people who smoke are 2 to 4 times at greater risk for having coronary artery disease, heart attacks, and strokes. Strokes 2 to 4 times as well. Cigarettes contain a host of toxins, including the chemical compound acrolein that we talked about. And this is a description that I wanted you guys to hear. Acrolein is a yellow, foul-smelling vapor that is produced by burning tobacco. It is so poisonous that it is used by both pesticides and in chemical weapons. Yummy. So that in itself says smoking is not in our favor. Smoking increases our risk for a number of complications with a number of chronic diseases, to include high blood pressure and high cholesterol. So, how do we manage high blood pressure, high cholesterol? One, knowing the status of your health, knowing what your cholesterol levels are, knowing what your blood pressure levels are, is important in your management. I've given you some information on what those levels should be, and we've talked about some of the things you need to do to bring them down if they're too high. Your primary care provider is one of the main members of your healthcare team. You are a member of your healthcare team, and you should advocate for your care. But communication and follow-up with your primary care physician, our clinics, is a must, and if you're going to manage your high cholesterol. Children who have family history of high cholesterol should be evaluated by a screening with your pediatrician. So that means if you are of childbearing years or you are raising your children and you have high cholesterol, that's something you want to make sure you tell your pediatrician so that your children can be screened as well. Because remember, we pass that gene on. And I thank you. These are the resources for the information that I've provided you today. I think if you'll go to the next slide, the next thing is, do you have questions? You can either put your questions on the chat box, or if you guys have questions, I'll be happy to take those questions now. Yes, sir.